Thank you very much for having us. And in the true spirit of collaboration, you have two for the price of one. So I guess are patient groups equipped to support early access schemes? I think we could probably win the competition by saying no and then walk off, but we won't do that. So I think a very quick show of hands. Who in the room has any idea what all of these words on this slide mean? Like, if you could say you know what every single one of those acronyms means, put your hand up. Okay, so I think there is proof in the pudding that people don't necessarily understand early access. This comes from gov.uk, and I did a fancy word grab from the page, and it put them all into a Word document. So essentially, we don't all know what all the terms mean, and we don't all understand what all the processes are involved in early access. So how then do we help people find their way to early access schemes? If people don't know what they are, how to get to them, how do we help people to navigate their way there? That came about through a conversation Lorna and I had last year at World Orphan Drug Congress around just the challenges faced by patient organisations and patients to try and access and understand all the terminology. We heard earlier about the whole idea of using basic language and using people not having good health literacy. So how can we expect people to understand all of these terms when we have so many acronyms banded around? So we wanted to come up with something that would help people to navigate their way to the early access programmes. So why do we want to do that? And I just want to very quickly read you something that comes from gov.uk's website. So early access to medicine schemes aims to give patients with life-threatening or serious debilitating conditions access to medicines that do not yet have a marketing authorisation when there is a clear unmet need. So I think the challenge lies here in that we've already heard earlier that doctors don't necessarily know where to access clinical trials, where to access early access schemes. They're not always aware of them. There is an advance in genomics. There's a lot more personalised medicines coming through. There's going to be a lot more clinical trials coming through that might be of relevance to our community. But if the patient organisations and the patients themselves don't know where to access them, and they're kind of the experts in their conditions, then how do they access them?
Thank you, Michelle. So I work for a company called Clinigen. My name's Lorna. I just want to start off by saying thank you to Beacon for inviting us today. It really means a lot to us to be here. Secondly, I'm a patient advocate myself, and I'm also an NIHR research champion up in Yorkshire. And this week I attended a conference where Lord O'Shaughnessy was addressing the audience and saying himself that he has a brain tumour in his family and he cannot navigate his way to help support them onto a clinical trial or an early access programme. If somebody in government who works in healthcare advising the government cannot do that, this is why we need a Navigate programme, and that's why we've got a Navigate programme. People need to know the context, what is early access, before they can even think about supporting the community appropriately. So that's what Navigate's all about, and that's why it exists. So it's a co-created patient education programme for the rare community, and it was set up, as Michelle said, following on from a consultation period that I took to understand from the community what are the challenges. So we've decided to launch a research survey, which is now live, and I'm going to share the link with you. And I've got some business cards with QR codes, if that's easier for you, to help you access a research questionnaire and have your voice heard to tell us what is it you would like to learn and know about early access to medicines. So that's still live, and it's going to be live, so please do take part and please do talk about it amongst your networks. We're going to publish the results of this in the Rare Revolution magazine, and then we're going to have a focus group towards March time next year, where we'll get some key members together to understand how we can co-create the training materials together. We're going to deliver the training in however format that is that we've decided once we've co-created together. And then we're going to be tailoring that for use worldwide, because we do recognise that every community is slightly different, and we do need to tailor, somebody was saying earlier, we need to tailor our information to the communities that we're communicating with. So that's essentially Navigate in a nutshell. And here is the link for you to have your voice heard in our online survey. So thank you very much.